The following program is in no way intended to replace your doctor's advice or treatment program, nor should it be used as a tool for the purpose of self-diagnosis.
Good night. Welcome to your Health Your Choice. It's Wednesday, the 12th of June, and we are live tonight. So I tell you that because we replay these programs on Thursdays at 1 p.m. and Sunday nights at 6:30 p.m. We are also on Facebook tonight, streaming live on our Facebook page, ACTN The Voice. So you can go onto Facebook as well. At the very start, I'm going to tell you that you can WhatsApp your questions on 360-0105, 360-0105. And later on in the program, we'll ask you to call in any of your questions. Now, this program is called Your Health, Your Choice, and it's very deliberate in that we want you to make wise choices about your health. Now, I know many of you associate this program with diabetes, but tonight we're not going to be doing diabetes. I'm very pleased to have with me Miss Ceylon George. Ceylon, nice to have you on the program.
Thank you for having me.
So, this is going to be a new area we're going to explore, Ceylon. So you're going to be teaching me. I'm excited about learning about this. Ceylon is a speech language pathologist.
Yes.
Did I get that right?
Big mouthful, but you got it correct.
Speech language pathologist. And you did your master's degree in speech language pathology. Now, I did my training in the UK, a lot of my training, and we used to refer people with strokes and all that for speech therapy.
Yes.
So when I first met you, I thought that's what you did.
Yes.
But of course, a speech language therapist is very different maybe to what I thought. So first of all, before we go deep into this, just tell me a little bit about your training, where you started this journey.
So, as Dr. Khan said, I'm a speech language pathologist, also known as a speech language therapist, also known as a speech therapist, all very synonymous, but meaning the same thing. I trained at Nova Southeastern University in Fort Lauderdale, Florida, and I have a master's degree to practice as a speech language pathologist. You do need a master's degree to practice as a speech therapist. In the States, in the UK and Canada, they don't have the same qualification, but it's similar.
Similar, okay.
Yeah, similar. And after getting my training as a speech pathologist, I branched out into working with young children. Now, just like you said before, excuse me, speech therapists do work with people who have had strokes.
Right.
We're so lucky we get to work with the lifespan. We work from birth to 99 or whatever, and everything in between. A speech therapist do work with people who have had strokes because speech therapists work with people who have communication disorders. And if you know somebody who has had a stroke, their communication tends to be broken down, or also they have swallowing disorders as well too. So that's where the speech therapist will come in as well.
So your journey started from Trinidad. Did you do any of your training here?
None at all. When I left Trinidad, I've never heard about a speech therapist. Never. It's just when I lived in the States, I would say, I don't want to say I stumbled upon it, because I started off wanting to be an elementary school teacher.
Okay.
And I used to volunteer at a preschool, and I saw somebody come in and used to work with the kids one-on-one, and asked about that. And they told me this was a speech therapist. Didn't know what that was. Spoke to other people, and they told me what that involved. Did my research and figured, well, yeah, this sounds like something that I would like to do. So I also have a bachelor's degree in speech therapy, in speech pathology, and my master's is in speech therapy as well.
So the reason I'm asking you that, Ceylon, is that obviously in Trinidad right now, we have lots of people, young people, trying to carve out careers, and the traditional careers of medicine, law, engineering is really becoming oversubscribed.
I think so.
And we often emphasize the team approach. In fact, when you first came to us, we talked about the Anaposa Center, and you were very much part of that before we moved away the church moved
Yes, I
away,
know.
and your offices are downstairs,
Yes.
and we'll talk about that on Lawrence Street. So, is there any training for speech to become a speech therapist in Trinidad?
Just recently, in the last, I would say, 4 years or so, UE in St. Augustine campus
Right.
had a master's degree program to train speech therapists.
Right.
And they had a cohort of, I think, of 12 students. Since then, I would say that was like about 2 years ago that cohort graduated.
Right.
And they were licensed up here in Trinidad as speech therapists. But since then, they discontinued the program. And I think it is a lack of mostly getting people to actually teach the courses.
Right.
As well as the resources here in Trinidad for those students to get like actual practicum hours
Right.
in the various aspects of becoming a speech therapist. Because like I just mentioned before, a speech therapist work with birth to adults. We work with people who have swallowing disorders. We work with people who are stutterers.
Yes.
We work with anything that affects your communication. In my case, I work with young children, and I see children who have Down syndrome, autism, cerebral palsy, any language disorders, speech anything, lots of
Right.
things like that. So I think right now in Trinidad, because it's a fairly new profession,
Yes.
and there isn't a whole lot of resources, as I said, for people to really get the true experience. Like when I was studying abroad, we were sent out to to the hospitals, we were sent out to the schools or private practice to gain that kind of basic knowledge in understanding what speech therapists do as such, you know?
So you began your career generally as a speech therapist,
Yes.
and then you focused in
Yes.
on disorders
Yes,
with
for
children.
young children. Yeah,
Okay.
that's my
So
specialty
most
area.
of your work now is
Yes, with young
kids.
children.
And
Yeah.
my office is just across
Yeah.
the road from you, and I see lots
So you
of
see the kids
young
coming in and out.
Coming in and out. Yeah.
Yeah.
Well, you've explained a little bit about what a speech language pathologist does.
Mm-hmm.
Now, we're not using the word speech language therapist. We're saying speech language
Pathologist.
pathologist.
We can use speech therapists too.
Okay.
Same thing, basically. Yeah.
And you made the point that in the U.S. system, you have to do a master's degree.
You do, yeah.
Before you're able to practice.
Yes.
And the people who were trained here in Trinidad, same thing would have applied?
Yes. So they went through a master's program.
Right.
And then they were licensed up under the Council for the Professions Related to Medicine. So you have to be licensed here as well too in order to practice as a speech therapist.
Right.
Yeah.
So I just want to remind you again, I know we are just getting into this on speech language therapy and the whole pathology associated with this. But if you want to WhatsApp your questions in, at this point it's 3600105. 3600105. Now, you've been practicing salon for about 10 years?
I would say, yeah, just about.
Okay.
Just before I came back to Trinidad, I'm originally from Trinidad.
Right.
And lived abroad for quite a while, and returned to Trinidad about 9 years ago.
Right.
So prior to coming back to Trinidad, I was practicing before. So yeah, I would say over 10 years I've been practicing now.
Okay.
Yeah.
And do you work, because I think the way we met was through Dr. Natalie
yes,
Dick,
Dr.
who's
Dick,
a
developmental
yeah, she's a pediatrician
Yeah.
with special expertise in childhood disabilities.
Yeah.
And by the way, hello, Natalie, if you see this program on
Right.
Facebook, whatever. And she's the one who introduced us.
Yes.
And then we started talking about working in the same vicinity. So do you work as a team, first of all? Is there a team that works with you?
Yes. Well, yes and no. I have private practice that I see my kids individually, but I also run and own an early intervention program for children with autism with 2 other speech therapists. It's in Port of Spain, however.
Right.
And in that program that we run, it's called Right Start, we do have a multidisciplinary team. So we have myself, the speech therapist, and 2 other speech therapists. We have an occupational therapist, a behavior therapist.
Right.
We have a music therapist as well, that work specifically with the kids that we see. there in our program in Port of Spain.
Okay.
Yeah.
Is that in the private sector?
And it's in the private sector.
Okay.
Yeah.
So, you know, one of the things that on my last program I was confronted with was, you know, we were talking about the Anaposis Diabetic Wellness Centers, and somebody rang in and said that it was, all of this was on the private, in the private sector. And was there anything available in the government? In the government centers, and my response to that was, you know, yes, we do have diabetic centers in the government hospitals, in the health centers, etc. But we are limited in what we can offer, and the reality is that there is a dichotomy between private and public practice. So, is there similar clinics being run in the government, in the hospitals like Mount Hope, Port of Spain, etc.?
Not really. I think Mount Hope have a child development center as such, like Dr. Dick works there, and she would refer her patients or people coming in there to the various amount of speech therapists or occupational therapists that's out in private practice.
Yes.
I know they tried to have some sort of like on-site treatment center there at Mount Hope, but with a lot of politics and a lot of red tape that just didn't go through. So the reality of the situation, as you just said, to get the kind of services that a speech therapist provide you, you know, you have to do it in private practice.
And so, one of the reasons I wanted to do this program is that a lot of medicine in Trinidad is very doctor-centric.
Yes.
Unfortunately. I say unfortunately being a doctor myself, because having been exposed to the team approach to diabetes, I would say quite clearly that our diabetes educators and some of the other healthcare professionals are as important or even more important than the doctor in diabetes care. Now, in terms of your own area, you know, a lot of people are going to be exposed for the first time to this whole concept of, you know, recognizing this problem in your child, first of all, because I guess like diabetes, to admit your child may have a problem, might be a problem. People might be in denial. Would you? Is that something that you encounter?
Totally agree. And even to go on what you're just saying, the list of the other professionals that I just listed off, the OT, the behavior therapist, we also have a counselor as well.
Right.
Because what we've been finding is that you're right, when you have a young child with anything that's wrong or anything that you suspect that's going on, to first admit that there's something going on with that child and then getting the help, sometimes it's just getting off that first level is really, really hard.
Right.
And when you do realize, you know, the child's been evaluated and they've been in therapy for a little bit, counseling for the parents, I think, is really vital.
Right.
And really even parent training for the parents to understand what's going on with that child and how to best help them, because as much as they can bring the child for therapy, the child spends most of the time with the parents.
Right.
So that's where I really try to push now for more than anything parent training.
Right.
You know?
And I know you have lots of sessions at our other center with at the church. We have a hall that you use, and I'm quite impressed. You know, I've been always I've been saying to myself, I should be having more sessions with my diabetic patients, but it's just to get the time.
I know.
So let's just first explore what is a communication disorder. How do you define that?
Right. So a communication disorder is anything basically that affects the way you communicate. If you are unable to get your message across to somebody in a very meaningful way, we will consider that a communication disorder. So for instance, if you, let's say you go to a foreign country or something, this is just an example, and you don't speak that language, how would you get your message across?
Right.
I mean, there are various ways that you can, you know, you can use sign language, you can use pictures, whatever. Now, in that situation, it's not so much that you have a disorder, you can still get your message across, but a communication disorder affects the way that the mode of communication then that you're using to get your message across. Your message might not be effective, the listener is not understanding what you're saying, or the way that you're trying to communicate just can't get your message across to the listener.
Right.
So in the case of, let's say with somebody with a stroke, usually people with strokes have something called aphasia.
Yes.
Right, and there are different various kinds of aphasia. You know, there are aphasia that affects memory.
Right.
There's aphasia that affects actual
Speech.
putting out of
The
this.
words, okay,
right.
yes.
There's aphasia that affects language, that sort of thing like that. So we will call that a communication disorder, because when the person with aphasia talks, the part of the brain that has been damaged and does not allow for the message to get across in an effective way, you know, it causes some sort of, the listener doesn't understand or doesn't get your message.
Right.
Yeah.
And I know this is not your main area of specialty, but I just say, I think one of the unfortunate things about people who have had strokes in Trinidad is that we still don't have this full concept of stroke units and rehabilitation units. Whereas I know in the US and in the UK, you would have a stroke unit where people would be either after discharge from the hospital, they would have a day hospital where they go and have physiotherapy, occupational therapy,
speech therapy, everything.
Speech therapy.
Like when I was living in the States, I was part of a team. I used to work at I'd say a rehab hospital.
Right.
So people coming in there have had strokes, and you know, strokes that affected everything, you know, their swallowing and their ability to communicate and that sort of thing like that. And you're right. I was part of a team with the doctors. I was part of the team with the physical therapists, the occupational therapist, the dietitian.
Right.
So we all worked together really nicely just for this one patient. You know, doctors would leave their prescription of, you know, they think this patient needs speech therapy. We would go in. We will evaluate that patient, talk to the dietitian now for special food to eat for that specific client. So a team approach is really very important.
And unfortunately, you know, one of the things, and I speak very openly on this program, Ceylon, you know, we have what, you know, people say are called stroke doctors in Trinidad, which I'm still trying to find out what that means.
Right.
Because there is a natural progression with strokes, for example, and there's people recover a certain amount of their the abilities that they have lost. But if we don't have all these, the team approach, people are, you know, going to healthcare professionals, getting injections, getting vitamin B12, whatever, but they're not getting some of the core essential aspects of therapy for strokes.
Yeah, and I would even go as far as to say, and this has been in my experience here in Trinidad too, that when it comes to stroke, a lot of the doctors aren't aware too that a speech therapist do work with
patients.
And of course, coming back to the fact that there aren't any speech therapists in the public hospitals, you know, it really is up to the patients to seek, if the doctors say to them, you know, we recommend speech therapy, to actually find one to work with that.
So there are actually no speech therapists in the hospitals?
I take that back. There is one speech therapist in the hospital in Tobago.
Right,
not Trinidad. Not in Trinidad, but in Tobago there is a speech therapist there. Yeah.
Okay.
Yeah.
So we're probably going to have to go to our first break in a few minutes. But before we do that, how does so we talked about the communication disorder, but how does the communication disorder impact a child? I know that's a big question.
That's a big one.
But how does it? Can we just start exploring that?
Sure, we can. Okay, so the kids that I see generally are between the ages of, I would say, average between ages 2 and 5.
Right.
You know, and at that age, children are what? They're talking a lot. They're interacting with the adults around them. They're playing with their peers. They're just learning how to play.
Right.
2-year-olds, 3-year-olds tend to like to come and bring things to show you. They're always showing off what they can do and that sort of thing like that. If you have a communication disorder at 2, think about how that affects parents interacting with their child.
Yes.
Because parents tend to ask their 2-year-olds lots of questions, and 2-year-olds love to express themselves. So it really has a breakdown in the relationship parent and child have
Right.
if a child cannot express themselves in an effective and meaningful way.
Right.
You know?
So I'm going to ask you to hold that thought
Sure.
because I just got the sign. We have to
Yes.
go to our first break. So we're going to go to our first break on Your Health, Your Choice. It's Wednesday, the 12th of June. I think I've got that right. 2019. We are live tonight. We're going to go to our first break and we're going to come back to Your Health, Your Choice in a few minutes. Thank you.
ACTN, The Voice, your family-friendly station.
Welcome back to Your Health, Your Choice. We're live tonight. It's Wednesday, the 12th of June, 2019. And I'm very, very pleased to have with us tonight Ceylon George, who is a speech language pathologist.
Correct.
And we've been talking about what you do. It's a new area for us on this program, exploring this whole area. And we started talking about communication disorders. How does a communication disorder impact a child? And we're going to talk a little bit about autism. Just before we do that, Ceylon, Josh, can I just ask you to bring up a flyer? I'm just doing a little bit of advertisement here. And Ceylon, you may want to come to this. It's called our Community Fair 2019 on the Coquet Recreation Ground, Saturday the 29th of June from 12 to 7 p.m. We have a variety of activities. It's a free outreach to the community. We have a medical booth. We have a petting zoo. We have aerobics. We have a dog show. Small goal football as well. Saturday the 29th of June. So you can ring on 482-4269, 482-4269. Thank you, Josh. If you're interested in that, that's our community outreach
Definitely,
fair.
I'll be there.
And maybe you can come and
For sure.
just visit us. So we were talking about how does this disorder actually impact a child, and I just wanted to spend a little bit more time on that before we talk about the autistic spectrum of disorders.
Okay. So like I said before, if a child isn't able to communicate effectively with the adults around them, the communication, there's a big communication breakdown. The child isn't able to give a message the way that they would like, and then the parents aren't understanding what the child is trying to to relate to them, in other words. And that is, you see that a lot when a child has autism spectrum disorder. I mean, we can talk about that now, you know, if that would lead into that.
Because part of the subtext of the program was early intervention.
Yes.
So why is early intervention, this whole spectrum of disorders, so important?
Early intervention, and as I'm sure you can relate to this to Dr. Khan being a doctor, the earlier you get something, you find out about something, the earlier that you get treatment for something, the better it sets you up for later on than as opposed to later on when the disorder or the disease or whatever it is that you have, you know, it's there for such a long time. It's harder to work.
Treat.
It's harder to treat.
Absolutely.
Exactly.
Same with diabetes.
Same thing with early intervention. The earlier we can get the kids in, and as early, I've seen kids as early as 11 months old.
Right.
When we suspect that there's something going on because they're not meeting their milestones the way that they should.
Yes.
And milestones are, you know, at a certain age, and this doesn't go for everybody, but a general idea. At certain age, I'd say age 2, a child should have at least 2 to 3 more words, able to come tell you something, able to answer questions, able to share things, able to point things out and tell you about it. If around 2 a child isn't doing that, definitely it's a red flag that something is going on. You know?
Okay.
And with autism,
can you just repeat some of those? Just repeat for my benefit, Ceylon.
I would say, actually, let me see. I have a nice flyer, a little here, that gives us a really nice, real information on if around, I would say age 2 tends to be about the age where you really see, and it could be before, but I would say around age 2 is when you notice that a child isn't developing the way maybe as the peers are. So I would say if they are not responding to simple questions, if they cannot answer a yes/no question, if they aren't pointing things out in the environment, like what's that? Oh, look at that. Not sharing something that they want to tell you about. If their vocabulary is less than 50 words, I would say those are some red flags for something that's going on with your child.
Right.
You know?
So the whole area of autism, I think it's shrouded in a bit of mystery.
It is.
We see lots of TV shows, movies about people who are autistic and have developed into geniuses kind of thing.
And there's that.
I just want to remind you, you can WhatsApp questions if you have tonight on 3600105, 3600105, and later on you can ring in if you want to ask Ceylon any questions on 652-4855. Tonight we're not really talking about diabetes, but if there are any pressing questions, I will answer them, but we're talking about more the autistic spectrum.
Yes.
So I know we have a clip that we're going to show, but let's just start exploring this whole thing, the autistic spectrum disorder.
Yeah.
ASD, you call it.
ASD,
yes.
autism spectrum disorder. So, autism is a social communication disorder, and I would say both words social communication is really what impacts a child that has autism. Social communication. So let's start with social communication. Just as some of the things I just talked about, if a child is at 2 and not doing these things. 2-year-olds are very social. They love to come up and show you things. They love to ask questions. Even before you're 2, even if you don't have words, I would say socially you're looking at the adults around you. You're tracking them when they're walking by.
Yes.
You're trying to connect. What autism does, it kind of takes away that part of the development. So a child with autism tend to be very, very isolated in themselves and does not interact on their own with the adults and people around them.
Okay. No, so, you know, I'm just thinking of, in terms of even eye contact. So with a 2-year-old, would you expect, now, I mean, of course, some children may be quite shy.
Yes, true.
But in terms of, you know, making eye contact, if you were to talk to a child, even if as a stranger, would you expect that child to make some level of eye contact with you?
I would say yes, and I'm glad that you just said that, even with a stranger. If you ever look at 2-3-year-olds, if they with their parents and a stranger comes up, they look at the stranger and they look back at their parents like, hey, is that person okay, mommy and daddy? Am I okay to go with them? Are you okay to go with them? So eye contact is a non-verbal way of communicating. So although we're not saying our words, we're still communicating with each other. And the children on the spectrum tend not to do that at all. Don't link up with their parents to make sure, hey, is it okay if I go over there? Even if I'm not saying it, I'm saying it with my eyes, I'm saying it with my body. You know? Autism really does affect that part of the communication. And just like you said earlier on, how does that impact a child and their parents? If a child isn't talking, I mean, that's the first thing that you would notice. This child is unable to let you know what their wants and needs are. Parents are trying to figure out what their wants and needs are because parents are relying on the child to have words. You know, and child isn't saying anything, so there's a communication breakdown right there. You know?
And for parents to recognize this, as I said at the start, it's often a big hurdle.
Yes.
And by the way, let me just give you a contact number before I forget to do that. It's this is a number that people can ring if they're interested in getting in contact with you. 487-9442. I know we give lots of telephone numbers out, but this one is for Ceylon, 487-9442. Let's go to the clip.
Sure.
So Josh, if we can play the clip. I think the clip is about 5 minutes long, so it's a little bit of a lengthy clip, but it's animated, so it should be quite interesting. So we're going to go to the clip and then come back and talk a little bit more about testing for autistic spectrum disorder.
We are all different. And that's wonderful. Some differences are easy to see. Height, hairstyle, gender, eye color, and so on. Other differences can't be seen. Our favorite foods, fears, or special skills. Interestingly, the way we see the world is also different. For instance, what do you see in this drawing? Most people see a duck, but some of you might have seen a rabbit. Whichever you saw, you are correct. This is just a trick drawing to show you that all brains work differently. The brain is your body's computer. It works differently for all of us and controls how you learn. That's why we are all good at different things. How you feel, which is why we all feel different emotions. And how you communicate. Sometimes the brain is connected in such a way it affects senses and how we perceive and read situations and interactions. This is known as autism. Many people have autism, so it's likely you already know someone who is autistic. And for this reason, it's useful to know a little bit about autism. The special wiring inside an autistic brain can sometimes make the person good at tasks we may find difficult, such as mathematics, drawing, or music. It can also do the opposite, and activities we find too easy are incredibly difficult to them, such as making friends. The senses constantly send information to your brain about your surroundings and other people. However, when a person's brain and its senses don't communicate well, the brain can become overwhelmed and confused, affecting how they see the world. Picture yourself walking down the street. This is how an autistic brain may experience the same walk. Scary, isn't it? Sadly, in many cases, the person can't say out loud how they feel. So even though there's chaos going on in their heads, they seem okay on the outside, unable to ask for help. We will develop behaviors to help us feel calm in uncomfortable situations. We may look away, hug ourselves, chew our fingernails, fidget, bite our lips, and so on. Equally, autistic people develop behaviors that help them cope with these intense moments. These actions may seem unusual, but they're just their way to feel calm. When they happen, it means they are having a hard time. The kind thing to do is not to give them an even harder time by getting cross, ignoring them, or mocking them. Remember, just because a PlayStation can't read an Xbox game, it doesn't mean it's broken. People with autism need friends who are willing to take the time to know them. With good communication and plenty of patience, everyone would be better off. People with autism are not ill or broken. They simply have a unique view of the world. And with a little support from their friends, they might just be able to share that view with us. Autism can make amazing things happen.
Okay, so that's was quite a lot of information.
Was.
We're going to have to, in a minute or so, go to our second break, but you know, Syl and I often say, having lived in another country for 15 years and coming back to Trinidad, that we live in a rather harsh culture here, dealing with things like depression, for example, abuse, and talking about autism. Very often, parents may take a wait-and-see approach.
Yes.
Because, again, you know, coming to terms, there's this idea, which we probably might explore, that boys tend to speak late their language development as a girl. But in your experience, our children, it's because the really hard thing about this is that we may have lots of kids in primary school who are suffering autism, misunderstood, and they're being probably punished, etc.
I would think so too. Yeah, I think so. It's one of those disorders that is not. You can't look at a child and say they have autism.
Right.
Not till you start interacting with them do you really realize that something's going on with them. As opposed to a developmental disorder as Down syndrome, there's certain features that a child has.
Yes.
Cerebral palsy, very obvious, you know, it's a motor disorder, so it affects the way that they move and everything like that. But with autism, you can't really look at a child, and each child with autism, you meet one child with autism, you meet one child with autism. Each of them very, very different. So you're right. So there might be children sitting in our schools, I think there are, who may have characteristics of autism, might not be like a full diagnosis of autism, but have characteristics of autism and not thriving too well in school.
Right.
And they might have some of the behaviors that, you know, because just like the little clip showed, they may be displaying some of the behaviors that they're doing that just to keep calm, and it's misconstrued as being naughty or not listening or something like that, you know? Yeah.
Okay, so we're going to go to our second break.
Great.
And when we come back, we're going to talk a little bit about testing and what are some of the treatments available for the autistic spectrum disorder. So we're going to go to our second break. Remember, we are live tonight. When we come back, I know it's a new topic, but if you want to ring in, if you want to send in any questions, we'll put up the numbers. So we're going to go to our second break on Your Health, Your Choice. Thank you.
Well, a pleasant good afternoon and welcome to Cloud 9 on ACTM The Voice. I am Sheldon Yerwood.
To bring some relief, to those who were badly affected.
But we feed into the soil, and how we water to determine the kind of fruit that we bear.
Lazy boat, lazy man.
Thank you very much. God blessings to you, and of course, be safe.
To have Ceylon George with us, who is a speech language pathologist. I got that right.
Yes.
Now the numbers are up there. I know it's a new area, but and some of you might be a little bit intimidated to call in, but if you want to WhatsApp your questions, it's 360-0105 or 652 if you want to call in, 4855. If you have any other pressing questions not directly related, yes, I will try and answer them. But Ceylon, we're going to go into now. We showed that very nice clip, excellent clip. But what are the tests? What kind of tests do you do to diagnose someone with the autistic spectrum disorder?
Now, because autism is it's a behavioral disorder, there is not like a test per se, like a blood test,
Right.
a brain scan, or anything at all that you can do to test for autism. There's something called the Autism Diagnostic Observational Scale, EDOS, nice and short. That it's clinical observations what we're doing, and a speech therapist will work alongside a psychologist, and we will sit and we will run a client through various tasks to test their communication skills. It's not something that's done very often because it's a very lengthy test, and it does take a team of people to do it. So in my private practice, as well as in Right Start, what we do our own clinical observations. I mean, over the years, I have worked with children with autism, so it's like, you know, I have honed my skills into that. So I know what I'm looking for. I'm not only looking for if a child is using words, but I'm looking at what their nonverbal communication is, how they're positioning their body when they come to interact with you. Are they bringing things to show you? Are they coming to tell you about things? Are they using eye contact to tell you things? So it's a lot of clinical observations and a lot of looking at specific communicative behaviors that we, if you want to say, test to really see if this child is displaying characteristics of autism, you know?
And I know parents, or, you know, again, our cultural background, we like sort of hard evidence.
Yes.
You know, so, you know, people would coming to me and with their diabetes, their blood sugars are high. We start talking, and you know, you kind of realize they're under a lot of stress.
Yes.
And I have to say to them, well, there's no blood tests for me to prove this.
Right.
That's the cause of your high blood sugar. So we're saying, I mean, you are going to have to say to parents, look, this is a diagnosis that is made by clinical
observation, and specific ones too. I mean, and I always even turned the questions back onto the parents, and I would ask things like, tell me, are they doing anything unusual at home? And when I say unusual, a lot of times children with autism tend to have very repetitive behaviors, like love switching light switches on and off all the time, slamming doors in and out, in and out. I mean, and some of those behaviors might be a typical 2-year-old doing it, but not for 10 minutes. Or running back and forth across a room for 15 minutes or so. Playing by themselves a lot. When you call them, like they're not hearing you. So those are kind of things like that. So I ask parents those questions, and then you can see them start thinking about, well, you know, yeah, he is doing some unusual things, or it's hard for me to play with him, or it's hard for me to find out what he really wants. And when I kind of turn it back on them, they start realizing, well, yeah, there's something going on. And you know what, Dr. Khan, even if we don't call it autism, there's something going on with your kid that we have to treat. You know, and the earlier that we get it, the better. You know?
And again, I mean, I think, you know, parents, obviously young parents, if it's the first child, they have all these aspirations, and to come to terms with, you know, something might be wrong is often very difficult. I know from my point of view, there was this whole discussion years ago of the link between the MMR vaccination and autism, And I mean, we have been battling in terms of not just the MMR and autism, but the whole anti-vaccination movement, I call it. Because, you know, and I've addressed this on the program over the last few weeks. There's in certain parts in the States and Africa, there's an outbreak of measles. I graduated in 1989, and I probably have never seen a case of measles.
You know, they have measles, and I think there's an outbreak in New York, Brooklyn, New York. And people have become very skeptical about. So, again, do you get those kinds of questions about vaccinations? I get it all the time. And you know what? Parents tell me a lot that they find when their child had their, I think they get vaccinated around age 2, somewhere around there. You know, they get their booster shot, so they get that MMR shot. They found that their kids started to regress in their development. I've had enough parents tell me that, and I don't think parents are making this up. But, you know, there's no research out there that really shows.
So as far as you know, I just want a second opinion. There's, I know in the early 2000s, there was some papers coming out suggesting a link. There was someone in the UK, but his research was discredited subsequently. So as far as you know, there's no direct link between the MMR vaccination?
As far as I know, and I've read some research but a lot of what in the research I've read too, what comes up a lot is the mercury in the vaccines and the thimerosal that's in the vaccines as well. For some reason, that seems to be like those two chemicals always seem to come up in a lot of research, and it's linked somehow with children who are on the spectrum. I'm not saying that's what's causing it.
Yes, because cause and effect is often a difficult thing. I think we have a call. Good night. Good evening. Welcome to Your Health, Your Choice. Good evening.
Hi, good night. Hi.
Good night.
I just have a simple question.
Sure.
It's based on my son. He's in standard 4.
Yes.
And I don't know if it's his brain is the problem, because like he does do his work in school, and when he come home, is a different story. He does his work good, but when it give him the questions to go back and do it over, he forget the answer. He give him a question to do, he will do it correctly in school. When he come home, he forget what he did. So like when I give him some words to spell,
yes,
he will spell it, but the day for the test, like his brain gone blank.
Okay.
So tell me that, like, what is your question then? You wondering if something's going on with him as such?
Oh, they may have, yeah, they've gone.
Yeah. I mean, just based on what she said, could be a lot of things going on. It might be some sort of language disorder that's happening, short-term memory. When he's in class, you know, it's almost like a drill probably happening.
Yes.
And so he knows it, but probably not retaining information to carry over.
Right.
So it could be something with a language disorder as such, you know?
Well, you know, what I would encourage this parent to do is, if you have any questions, you can contact Ceylon on 487-9442, 487-9442. We also have Ceylon's contact details at our main office, 482-4269. We don't have, time has gone very quickly, Ceylon. But what are some of the treatments for the autistic spectrum disorder?
So right now, as I mentioned earlier, I think parent intervention is the main thing, and a lot. If you look for any sort of treatment for autism, you see parent training, parent understanding, parent knowledge is important for that. I would say parent training, parent understanding, definitely get in therapy sessions with a speech therapist who know about autism, and learning everything that you can about it along with your therapist, you know, and let that therapist guide setting goals for your child.
So very often this would be a long-term relationship between yourself and the family.
I have kids in therapy at least 4 years. I've had kids and I've seen them from age 2 and they are now 6. But what happens along that time, now that they're 6, it's almost like I have done my part and I try to refer them on to another therapist who can work with them at that age, you know, for different goals to met. Remember, I'm doing early intervention, so I'm really setting up the basic foundations for them.
Okay, so there are other speech therapists who would specialize in the older age group?
I would say yes and no, but yes, who would see older children. And again, here in Trinidad, our resources are really very limited, especially when it comes to our children with autism. And as they get older, depending on the severity of the autism as well too, we start looking at life functioning, life skills, and that kind of things for them, you know? Yeah.
And where does the pediatricians come into this whole team approach?
I know. I get a lot of referrals from pediatricians now, because generally pediatricians are usually the first line of people that you see with a child who has anything, and the pediatricians, they really should be knowledgeable as well. What are some of the signs? And it doesn't necessarily have to be signs of autism, but definitely if there's a child is not meeting milestones, I would say at a certain age, I think pediatrician should definitely know how to refer that child out. You know? Yeah.
So we kind of gonna be summarizing a little bit now. You know, we very often, as I say, as parents, we have our aspirations for our kids. Someone with a young kid with autism, what is the outlook for them in life?
Well, I'll quickly say, based on my experience from working in the States, the outlook there, it's a little more hopeful. Because as the kids get older and enter the teenage years, enter the young adult years, there are programs set up, housing programs, work programs set up for them. Here in Trinidad, again, resources are very limited, and most of the times I find the kids either go to, they have some living skills programs here, but not not a whole lot, and there's wait lists for some of them.
Right.
But a lot of kids end up being home with their parents.
But is it, there's this kind of concept I have in my mind, looking at movies, that autistic kids are often very gifted in music, computer skills. Is that accurate?
I would say yes, for the most part. A lot of them tend to be really good at things with numbers, things with letters, music, because you know, with autism, they kind of concentrate on one thing. That's like their thing they will do over and over and over. And the more you do something over and over, the better you get
so
at
it's a
it.
repetitive.
Yeah. I think they said Bill Gates has autism.
Really?
Yes.
Okay.
Yeah. Not very social person. If you kind of look at him, you know, he's
I wonder if my wife would say that I'm autistic. You know, people think Solon, that I'm very outgoing, but this is learned behavior.
Really?
I'm very much an introvert.
Are you really?
Yes, but, it's hard to believe that.
Maybe
but
you could come see me.
I'm maybe a little bit too old at my age, but Linda is the one, you know Linda well.
I know. Yes.
People love seeing her on this program, but she's really the very outgoing person in our relationship. We only have about 4 more minutes.
Yes.
So one of the questions, well, the last question is, what are your future plans as a speech language
My future
pathologist?
plans, that's a big one. I am very much parent driven these days, really trying to educate my parents, really trying to take care of my parents, or let my parents understand they have to take care of themselves in order to take care of their kids.
Right.
So I'm always trying to get my parents into counseling.
Right.
To do the parent training with me. Really would love to set up some sort of program where parents have a forum, something like this, where we can discuss issues, because I think a lot of parents feel that they are in this on their own. And I have seen it in my parent training. When they see other parents, they can't believe that other parents are going through the same thing.
Yes.
So I would really love to, moving forward, really be parent-centered, always helping the kids as much as I can, you know, whatever I can do.
Yes. And I mean, Solon, I know that you have a lot of sessions, as I said, at downstairs of the Annapolis Chapel.
Thank you so much for that.
Number 12 Johnson Street.
Yes.
A little plug for the church as well. But it's a pleasure having you there, because it's a nice space that you can utilize, and it's always nice when I drive in on Tuesday evenings when we're going to have our Bible study and prayer meeting upstairs.
And
you're
we're
downstairs with your parents.
Thank you.
It's a nice combination. I think a holistic approach to healthcare is so important.
It is. It is.
And that's what you're doing. That's what we try to do. So I want to highlight again, Solon, you're a speech language pathologist.
I am.
We only have 3 more minutes. Is there, one last question, is there any relationship between attention deficit hyperactivity and autism?
There is a correlation. A lot of kids with autism do go on eventually have ADHD, but not because you have ADHD, you have autism.
Right.
Yeah.
Because as a family doctor in the UK, I had to deal with ADHD a lot.
Yeah.
And it was to me, I call it a very popular diagnosis.
It is still.
And I was not sure if it was being overdiagnosed.
I think it is still.
In Trinidad, I think we're still, well, I'm not seeing that group of patients anymore. But I wondered about that. Okay, so great. Thank you so much.
Thank
so your
you for
contact
having me.
number is 487-9442, 487-9442. Is that a WhatsApp number as well?
You can get me on WhatsApp as well too,
if you have questions for Solon, you can WhatsApp your questions on that number. But you're based in Vistabella, number 9 Land Street in Vistabella. And that's just opposite our Diabetic Wellness Center. And you're also based in Port of Spain.
Yes.
Where's your base in Port of Spain?
3 Carlos Street in Woodbrook.
Right, 3 Carlos Street. Same telephone number?
Same telephone number,
Thank you so much.
Thank you so much for having me.
Josh, can you bring up that flyer one more time? It's I don't know if you can bring up the flyer. I think we have just about 2 more minutes left. So it's our community fair. The Annapolis Chapel presents Community Fair 2019, Saturday the 29th of June on the Coquille Recreation Ground. We have a dog show, a small goal football, a variety of medical booth, lots of giveaways, a concert on the evening. Ring us on 482-4269. We can just come off that. flyer. And just to tell you again, our diabetic wellness centers, our main centers in Vistabella, 482-4269. We're based in Chagonas as well, 665-1141. And we now have a center in Pinal, and the number there is 222-2363. Those are the diabetic wellness centers. I often put on my pastoral hat as I end, and one of the things I mentioned last time was our concern for the immigrants that are coming to us. I think we are conscious that there are people coming to our shores who are in desperate need of help. And my concern recently on Facebook, and even from some people in places of authority, there have been some language that has been very inflammatory. Now, I understand that we have to look after our citizens, and I admit I'm a globalist. I see the world without borders, but I understand that we must have borders, we must have immigration policies. But can I challenge you? In this country, we are blessed. We are only 1.3 million, but we are blessed. And can I challenge you, whatever background you are from, whatever faith background or otherwise, let's have helping hands and hearts of compassion for those who need our help. This has been Your Health, Your Choice. Thank you for joining us tonight. If you have questions, you can ring us on 482-4269 or WhatsApp your questions on that number, and this program will be replayed tomorrow, Thursday at 1 p.m., Sunday nights at 6:30, and we come back with a live program in 2 weeks' time. Thank you so much for joining us on Your Health, Your Choice.